This video will give an insight into the research we hope to carry out, investigating the use of personalized medicine in the treatment of oncogenic viruses. Human papillomavirus, otherwise known as HPV, is a group of viruses that affect the skin and the moist membrane lining of the body, such as the cervix, anus, mouth and throat. There are more than 100 types of HPV with 13 different types of strains, which can cause cervical cancer. These are commonly spread during sexual intercourse and skin-to-skin contact of the genital areas. HPV is the most common viral STI in England. HPV vaccinations are routinely offered to girls aged 12 to 13, but are not yet offered to boys. However, offering the vaccine to boys will help prevent more HPV-related cancers. HPV can cause abnormal tissue growth and other changes to cells within your cervix, which can sometimes lead to cervical cancer. HPV infects epithelial cells, and after integration in host DNA, the production of oncoproteins, mainly E6 and E7, disrupt natural tumor suppressor pathways and is required for proliferation of cervical carcinoma cells. In 2018, approximately 311,000 women died from cervical cancer. More than 85% of these deaths occurring in low and middle income countries, where effective but costly pap smear screening programs are not in place. Approximately 1.6 million of the 2 million new cancer cases each year due to infection arise as a consequence of persistent infection by oncogenic viruses. Per annum, the NHS spends approximately £25 million on HPV-related cases, demonstrating the huge economic burden of the disease.
Following HPV infection, the virus induces mutations in the genetic material of the cervical epithelium. Afterwards, cervical intraepithelial neoplasia occurs, where the normal cervical cells are replaced by abnormal cells. There are 3 grades of CIN, which range from low to high grade, depending on the thickness of the abnormal cells replacing the normal cervical epithelial cells, and this could develop over the course of many years. Once the abnormal cells invade the deeper layer below the basement membrane of the cervical epithelium, it becomes an invasive carcinoma.
There are currently a variety of different drugs and vaccinations used in the treatment and prevention of HPV, such as acetic acids, immune response modifiers, interferon alphas, and podophylotoxins. However, we are aiming to maximize the efficacy of the drugs available for oncogenic treatment. We aim to optimize drugs and drug combinations through the use of personalized medicine by considering genetic variations and the differences associated with patient drug response. Using personalized medicine to try to reduce the death rate of HPV infections to target people's individual genetics in certain regions. Current HPV treatments are highly effective, but were not first used until 2009 in the UK, and there are currently many women living with the disease. Many women do not have access to any treatment or the vaccine, so the intention is to make it accessible and affordable to them. We aim to research potential ways of treating HPV, possibly by targeting the particular pathway associated with the activation of protein oncogenes by E6 and E7, or the mutations of tumor suppressor gene P53. The transcription factor STAT3 has piqued the interest of researchers. STAT3 is activated in a large variety of tumors, and blocking STAT3 results in tumor cell death. We can further investigate STAT3 and its apoptotic functions as a possible treatment of HPV-related cancer.
Our overall aim for this research is to develop personalized medicine for the treatment of oncogenic viruses. Due to the high prevalence of deaths associated with the oncogenic viruses, we aim to reduce mortality and morbidity rates of HPV-related cancers. We hope to collaborate with organizations and research universities already focusing on HPV, genomics and personalized medicine, such as UCL and Cancer Research UK, in order to enhance the developmental process. In order to carry out this project, we hope to acquire funding from pharmaceutical industries and entrepreneurs. The budget for the project includes equipment, reagents, researchers, and media campaigns. We hope to publish our findings in peer-reviewed journals over the duration of the project to keep the public aware of our progress. Depending on the success of our research and the funding provided, will determine the time it takes to carry out this research project and the future of personalized medicine.